Hello and welcome to InSight. I'm Wendy Brokaw.
And I'm Louise VanNatta.
And today we are talking about diversity at Salem Hospital. We have a lot to cover today about patient needs, people need, how we talk to one another, how we get our messages across in many different languages representing our community. Couldn't think of any two people better to talk about that issue than Samuel Pino, who is head of interpreter services, and Cecilia Estel, who is the patient advocate. Welcome to InSight.
Welcome.
Thank you for inviting us.
Thank you for having us here.
So, diversity means a lot of things, doesn't it? I know that Wendy mentioned language, but there's more than that to diversity, isn't there?
Absolutely. Yes, we at Salem Hospital, we wanted to see, we want to see diversity beyond language, beyond ethnicity. And there are many areas that diversity is represented.
And give me some examples of what that would look like.
For example, age. For example, sexual orientation, political view, and
faith and upbringing, probably, and region that you came from, even here.
When we talk about diversity, I heard there were something like 17 different languages that people can call on immediately if they are going to the hospital. Is that true? 17 different languages that you can get help being understood. Is that right?
Yes, we have, it's usually Spanish is a language that is common, but we've seen every day different other requests for languages, and we have Russian, we have ASL, American Sign Language.
Oh, sure.
It's often requested, and also Vietnamese, Chuukese, Marshallese, typically from requests from Salem. We see more African languages, Indian languages, and also native languages from Mexico or Guatemala also.
I imagine those folks have to be specially trained, don't they? Because they're in a medical-based environment. Is that correct?
People that work as interpreters.
Yes,
absolutely.
Or even as a patient advocate, they need to know a lot more about the medical side of things than just.
Well, we rely on our certified interpreters, and probably Samuel can explain. Our interpreters are used even in different areas. Us as patient advocates, if we speak another language, then we'll speak it in our role. But even if I know another language, I use it only on my role. Yeah.
Yes, there is a training, there is a certification. Oregon is one of the few states that requires certification for interpreters that work in a medical setting.
Oh, does that please you?
Absolutely, yes. It's very important because as an interpreter you work, you have lives of people in your hands pretty much.
Sure.
And so you need to have a training on, how to deal with situations.
Samuel, one of the things that I enjoyed so much was the little video that you created for Salem Hospital. It was deeply moving to me. Tell me about how you came up with the idea, and we're going to see that video in a minute.
Thank you very much. Yes, Wendy, we are part of a diversity committee at Salem Hospital, and a great, passionate group of people that are very interested in diversity. And so this year we wanted to uncover stereotypes and different ways that people have been seen because of their different background. And so I asked at the hospital if people will be willing to share with me what those stereotypes they faced. And so there were some people that came up and said, yes, I would like to talk about it. And so, I guess we can talk after we watch the video.
And the whole idea of the Diversity Week that we organized with this diversity committee came up exactly about that diversity is seen as one thing. And, there are trainings about diversity, basic trainings, but we wanted to move beyond that. So how do we become aware of when we have maybe myths or biases? So Salem Hospital wanted to dive a little farther to see how we could help employees and patients to better understand each other, to develop a great relationship.
I'd like to show everybody that video. Let's take a look.
Okay.
Wow.
Wow.
That-
That was really something.
That had to take real courage to do that, didn't that? For all of those individuals?
Yes, especially that they work in the hospital.
Oh, yeah.
Mhm.
Extraordinary. How do people learn more about your program and how to get in touch with you?
Well, they definitely can reach out to patient advocacy, and we are linked to all the different departments in the hospital. Samuel,
I assume you have a
as a
website,
supervisor.
Salem Health?
Yes.
Yes, we
Yes.
do have a website also. Patients that need our help with the specific department that they are working at, the departments know how to get hold of an interpreter, my team. And there is a way that they can contact us through the department.
So if someone found themselves in the hospital, they would right away want to let someone know if they have an issue or a language barrier or a cultural barrier, or one of their family members does, is to reach your office right away
Yes.
and
And-
start that process early.
And the staff does it as part of the assessment,
good.
right when you register
Great.
for any of any services. One of the questions it is your language. What is your preference language to communicate with?
Cecilia, is the hospital kind of leading the way in this effort, do you feel?
I think there's efforts everywhere in Oregon about moving beyond just the knowledge of diversity, especially with patient communication, with providers being led by a lot of federal organizations. I think, yeah, definitely we want to go in the lead and hopefully be the leaders on this. Yes.
Diversity is a strength, and the hospital sees that as a very important. And so we wanted to work with a diverse group of people, use the best of the gifts that they have to help our community, our diverse community too.
That's wonderful. So it's salemhealth.org, correct?
Yes.
Okay. Is there a phone number they can reach you at?
The main number?
Yeah, the main number, and they will reroute patients to patient advocacy or to language services.
503-561-5200.
5200. We'll put
That
that, up
makes
on the screen there for
Absolutely
you.
great. Oh, thank you so much for joining us. I loved that video, and I look forward to perhaps having you back another time so that you can tell us more good things that are going on at that hospital.
Well, thank
Thank
you
you
very
very
much.
much.
Thank
Thank
you,
you.
Wendy.
for
Thank you
inviting
so
us.
much for being with us today.
Thank you.
And thank you for joining us today on InSight.
Thanks. See you.